All right, everyone. Thank you for being here. We're going to take maybe 60 seconds to allow folks to get situated, get what they need for this 2-hour session that we have together today. Already so excited that you're here. I'm going to give you 30 seconds and we'll jump in. Thank you. Thank you for being here. All right. Good afternoon and welcome to Tackling Access Together. My name is Rachel Wiley and I serve as the Bay Area Executive Director for Pure Health Exchange. Happy World Mental Health Awareness Day. We're really excited that you're here with us today and sharing in this conversation. I'm pleased to be the host of both of today's conversations. As you'll see, there's a banner that we all get very excited about that's running at the bottom of the page that will have information for you, updates, questions, etc. First and most importantly, we are grateful to you for giving of your time this Saturday to join us. This is an event that is unapologetically dedicated to a conversation about just how much mental health matters for communities of color and how we can, in community together, expand our understanding about how we can self-advocate and also support one another. This event, you should know, is a partnership effort between MOCHA by Marie and Pure Health Exchange, and was generously supported by Blue Shield of California. Thank you for that support. Our hope, team and community, is that you walk away today having gained at least one key piece of information that you can apply immediately to your lived experience. We also hope, on the flip side, that you leave really believing that you have the full support of this community here today to prioritize your mental health every single day. I'm excited about this because I'm here to learn too. As a Black woman who was affected on multiple fronts by this social, political, public health moment, I am here to learn alongside you all. I'm also working every day to love myself enough to honor the need to prioritize my mental health daily. This is a space to hear from folks who have wisdom to offer. We have 6 wonderful, beautiful people that are here to talk with you today. We consider them experts because of their professional expertise, but also because of their lived experience as folks of color, and that part is important. I also want you to practice what it feels like to call yourself an expert as well. Oftentimes that's not talked about. I want us to really practice that today and really think about the fact that we are experts around our lived experience. We're going to talk today about self-advocacy, and that component of accessing mental health resources necessitates that we understand as folks of color that we are also experts around our lived experience. And actually we are the key experts around our lived experience. Last thing, I want to make sure you know how critical it is to have resources that you can take advantage of beyond this space. At moments throughout our time together, so as I called out earlier, there's a banner that runs at the bottom of the page. You will see the number for the National Suicide Crisis Hotline. There it is right there in the banner at the bottom of this screen. The Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you or for your loved ones. Keep it saved in your phone. Keep it tacked up somewhere where you can see it really easily. Keep it where you can access it easily. This is an important number to keep on hand. Very last thing, I would be remiss if I did not say that this event is the brainchild of none other than Imani Lewis, who is the founder of MOCHA by Marie. We are fortunate, so fortunate that she invited Pure Health Exchange to partner with her to bring this idea to life. Imani has such a beautiful and important impact vision. I'd like for you to hear from her before we begin. Imani, thank you.
Hello, thank you so much, Rachel. Thank you so much. I really appreciate it. Being a new nonprofit, I am so grateful that we have the opportunity to partner with amazing people and organizations like Pure Health Exchange and Blue Shield. So thank you so much, Rachel. So why MOCHA? And what is MOCHA by Marie? I'd love to share because there are so many nonprofits. We're not even talking about the Bay Area. I'm talking about just Oakland. There are 6,000 registered nonprofits in Oakland alone. That's a lot of help. That's a lot of services and a lot of organizations. But many don't know where to turn to or where to start. So my team does the research for you. We find the resources. We look up any agencies that are doing a food drive, a resume workshop, a free clinic, or even who is hiring. We find things and we post them on our social media pages to make it easier for families to access, digest, and share, and also to make it easier for organizations to do their advertising of their services as well. We have a mini directory of resources on our website that we constantly add to. It's currently being updated right now, and MOCHA by Marie is a virtual hub for all services related to housing, education, employment, and healthy living. We bring together the community, people, and organizations to improve access to appropriate services and vital information needed to really lead healthy, choice-filled lives. So when I think about my own story, it all starts with mom. My mom has always been very resourceful. I mean, between my mom, my aunts, my grandmothers, these are the women who took care of me, and they are a force. They build relationships to take care of everyone else, but who takes care of them? I want to see moms really thrive and feel like opportunities are at her fingertips, quite literally, which is why our name is MOCHA, Mothers of Color Healing Association. Women of color face an opportunity gap, meaning lack of access to certain resources based on race, zip code, and other factors. And with the shelter in place and COVID, there's no better time than now for this. We need these types of events. We need this directory. We need these sorts of partnerships. It's for us. It's by us. We need to support our mothers of color to close the opportunity gap. So having launched MOCHA last year on October 19th, MOCHA will actually reach its 1-year mark next week. We will continue to do these types of events in partnership with other orgs to highlight their presence in the community. Next month, our event will be about college applications, for example. We will continue to post resources on our Instagram, Facebook, and website. And please reach out to info@mochabymarie.com to contact us. We have so many great things in store for our community, so please reach out to us, starting with this event today. Thank you so much for joining us. Thank you again, Rachel. I know we're in excellent hands with you, and I'll be soaking up info from you and our guests right along with the audience.
So beautiful. Thank you, Imani. Clearly, you all can see she's a wonderful individual. We want to make sure that you know her. Again, this is her vision coming to life today. She wanted to make sure that we had this moment to talk together in community. So Imani, thank you again. The first person that we have coming to the stage today is Ashley Wisdom, who is the founder of Health in Her Hue. And the conversation that we're going to be having is around cultural competence in healthcare and why that's critical. I'm going to call Ashley to the stage real quick, and then I want her to introduce herself when she's ready to do so. Here she comes. Hi, Ashley. It's good to see you.
Hi, Rachel. Hi, everyone. Thank you for having me in today's session.
Thank you for being here. So first and foremost, community, I'd love for you to meet Ashley. Ashley, I'm going to ask you to introduce yourself because you are the best person, of course, to speak about your lived experience naturally. But what I will say before you start, because I know you won't say it, is that Ashley is one of the most visionary people around healthcare that I've ever met. Every time I have occasion to talk to her, I leave feeling more inspired. And I also leave feeling like I need to be even more focused on how I support community within the space where I have influence, and that I need to keep this conversation going as often as possible. And so first, Ashley, before we launch into the questions about this topic around cultural competency, please just tell us who you are.
Thanks so much, Rachel, for that very generous introduction and intro. So my background, actually, I was introduced to the world of public health through Peer Health Exchange. So being invited to speak today feels like a real full circle moment. Public health enthusiast. I am a health equity champion. I went to Howard University for undergrad and was on the pre-med track. But like I said, I encountered the Peer Health Exchange program, and that exposed me to the world of public health. And I realized that that was where I wanted to focus my work and advocate for social justice through healthcare and health equity. I've worked for a variety of healthcare organizations. I've worked for a federally qualified health center. I've worked for academic medical centers, and most recently became really passionate about how we can apply equity to healthcare innovation. And I'm working on my own startup, Health in Her Hue, and I'm sure I'll dive more into what Health in Her Hue is as we get into the conversation. But that's a bit about me. From New York, love people of color, love being an advocate for healthcare, and I'm just excited to share with you all today.
I love it. Thank you so much, Ashley. I also share your love of people of color, and so that's one thing that we know we have in common.
Absolutely.
Conversation in this vein. The first question that I have for you is, how do you define cultural competency?
Yeah, so cultural competency, I think of it specifically in the context of healthcare, and I would say that it's care that respects the diversity of the patient population and acknowledges and takes into account the factors that affect health and health outcomes, such as language, communication styles, attitudes, behaviors, and a person's context. I think that all of those things need to be taken into account in order to give true quality care.
Absolutely. So given the fact, I mean, we talk so much about health and her hue, and I've told you many times, I mean, I'm on the platform. I love it. I can't wait to use it more and dive into more conversations about issues that impact folks of color relative to health. Talk to us a little bit more, as you said you would, about health and her hue, and what gaps you're working to address with that platform and how that relates to cultural competency.
Yeah, so Health Interview, it's a digital platform to connect Black women, women of color to culturally competent healthcare providers, healthcare in services, and also content. So I've recognized, working in healthcare, that a lot of the information is stuck in the ivory tower, or it's disseminated in a way that really doesn't reflect or speak to patients' lived experiences. And so that is what I'm building with Health Interview, is a space for women to connect with providers who they can feel like they can trust and will relate to them. And it also offers content that is not only accessible, but also reflects the experiences of Black women and women of color. And then we're also building community, because that's an important part of the healing process. That, I as much as I love self-care, I believe that care really comes from community, and that we need each other as we're trying to navigate a healthcare system that wasn't exactly built with people of color in mind.
I have all the snaps for you about that. And I think that is a conversation that we need to be having more often. And I think will be a thread throughout this conversation over the next 2 hours is we both, as you said, have a responsibility to make sure that we do our self-care exercises, whatever that means for us, but also that we support each other in community to be able to do that. And, as I've engaged more and more with Health and Hue as a platform, I've been able to see the way in which what you've created allows folks to really exchange. It's not necessarily a space from where I sit where all the answers have to come from the people that we deem experts. Sometimes I see folks who are peers exchanging with each other, sharing information, opening up conversations, which I think is a beautiful kind of agency related way to engage in the platform as well.
Yeah, absolutely. I think that's an important thing. I think there's so much traditionally healthcare, there's like this information asymmetry. We see doctors or providers as being the experts, and we forget that we have agency as well. And so that is a piece that I really want to drive home, especially to Black women and women of color, that for as long as our healthcare system treats healthcare like a commodity, then we should be smart consumers of care and be savvy advocates as we're navigating choosing our healthcare providers and the system generally.
I love it. I told you she knows what she's talking about. So we're going to keep going. What ways in which, and we spoke to this a little bit a second ago, but are there any specific ways that you'd like to highlight where you've seen folks leverage this platform to do exactly that, to really kind of take back the conversation around health, maybe particularly mental health, versus waiting for doctors who may or may not share our experience to tell us how to move in that space?
Yeah, so I mean, I can give a couple of examples. We've had women who, and right now we just have a prototype out. It's not our fully formed product, but even with what we have out in the universe right now, they feel like they have agency to choose a provider. It makes the vetting process a lot more seamless for them, because at first, as women of color, Black women, I know when I look for a doctor and I look through my health insurance network, the first thing I'm doing is like scanning through it for familiar faces or for names that indicate that this person might be a person of color. And most of that experience is not really seamless. Most insurance companies don't always have photos, or sometimes their provider listing isn't up to date. And so what Black women have been finding super valuable with Health Interview is that's like half the battle. I go onto a platform and I know that everyone here is going to look like me. And then I can go through and see like who has the expertise that I need, who approaches trauma in the way that I need them to approach trauma. And it just makes the experience less onerous and less intimidating. I've had one doctor say that she walked into the room with the patient, the examination room, and saw that she traveled quite a distance to come and see her. And so that opened my eyes to the fact that like patients are willing to commute if they have the resources to commute, because we know transportation can be a barrier, but they're willing to make the effort to find providers who they trust. And so I'm super happy that I was able to leverage technology to give women that agency to find, in a much easier way, find providers that on face value, they feel like they have some level of baseline trust because they feel like they'll understand their experiences.
Absolutely. Absolutely. As is typical of me to do, Ashley, as you know, I had a statement that I wanted to provide to people to hold on to at the start. And I was just so excited to start that I didn't hand it to people. But what you just said reminds me so much of that. And the statement was, it matters who we trust with our health and with our well-being. And so much of what you're saying, I think encapsulates exactly that. We sometimes as folks of color are not used to having a lot of agency, not used to having a lot of say in how things move around us, especially when we're talking about systems and institutions. And so much of this conversation, which you've created, but also the conversation to come, is going to be about how do we take back agency where we have it by making sure that we have the knowledge to do so.
Exactly. Yep. I love that.
Let's talk about barriers. So I would love to understand, you've spoken to some of this, but I'd love to just have a slightly more robust conversation about it with you in this moment. What makes it difficult for folks to access culturally competent care?
Well, for starters, there aren't that many providers or practitioners of color, period. So that's like the first and foremost, like the first problem, and that's a systemic problem that needs to be addressed. But then, once you even get beyond that, it's difficult to find these providers. Like I said, some of the, like, as people navigating the healthcare system, we're stuck with the doctors that we have access to through our insurance network. And for many of us, our insurance is tied to our employment. So we're very limited to which providers we can see. And then on top of that, the providers that look like us, they're few and far between. So it's just difficult from a systemic standpoint. And then even technology, there are lots of platforms like ZocDoc, Psychology Today, that have, a very robust list of doctors, a directory of doctors, but you can't filter for race on those platforms. You can filter for a lot of other variables, but not race. And that is an important thing. Culture and language is an important thing for patients who are seeking for providers. So I would say that it's a bit of the lack of it's a lot of the fact that there aren't many providers, period. And then it's not easy to access their services or find their services online.
Yeah. And I was tempted to say to you, it makes sense. And it actually, if I'm just being honest, it doesn't make sense, right? It's 2020. And so we should be able to, our system should support us in the ways that we need it to for this present moment. And so much of the conversation that we had before this moment, but also that's developing in this moment too, is like, how does, and this is a rhetorical question, but also feel free to answer it if you'd like to. How do we actually push our institutions and our systems, specifically the healthcare system, to make sure that it's responsive to that which we need, right? I think in today's society, to not be able to filter for race indicates a gap in understanding about the importance of that on the part of systems.
Right. And so as I've been doing research and asking some of these companies why this doesn't exist, what I'm learning, it's not even really a compliance or any legal issues. I do think that there's a sensitivity there that some people might be biased to certain providers, but it's also just who's building these technologies, like who's building these systems. And if these are not pain points for them, they're not going to build solutions for them. So there's that. I would say as patients, we should speak up. So like now that I learn how much power insurance companies have with who they have in their provider network, when I call up, I'm like, look, I want a doctor that's a doctor of color. I want a doctor who specializes in XYZ. Like, if you make those asks, these companies will have to meet the needs of their members. Like, they want you to be healthy. They want you to stay in their insurance network. They want you to pay your premium, or your employer to pay your premium. So I think speaking up about our needs is something that we need to be more intentional about. And I'll share one anecdote. I think I had shared with you before that a therapist that I know, she mentioned that a Black woman came to her and said, I want to get your services, but you're not in my insurance network and I can't afford your cash pay rate. And so she said, what insurance are you in? Let me see if I can try to get in network. And she called, and the insurance company said, we have too many providers in your geographic location already, so we can't bring you a network. And that was something that I wasn't privy to. And I thought, I've struggled with, I really want to go to this therapist, but she doesn't accept my insurance. And so there are barriers that some of these providers of color are experiencing, trying to make themselves more accessible and more affordable to patients who would prefer to see them. So it's something that the insurance companies need to be more intentional about, making sure that the providers who are in their network are representative of the members that and the lives that they're actually covering. And so I'll get off my soapbox there.
No, stay on it. I mean, this is the purpose of the conversation. And just so you all know, I mean, this is the conversation that Ashley and I have all the time when we speak.
Yes.
And I love it because I learn each time, but also it then motivates me to think about, to your point about, we need to be, as consumers, we need to be pushing back on these systems and institutions and giving feedback and saying, so what you're providing me is not working for me. That's a business conversation, right? Some people may not care on the level of social issues, on the level of race. That may not register for them at all, but they speak the language of money. So
exactly.
How do we meet them at that place and speak to that part of the conversation? And then, what you made me think about a second ago was like, how do I also not do that again in the spirit of both self-advocacy and community advocacy? How do I make sure that I don't just do that for me, but I'm also asking my girlfriends, like, are you talking to your insurance company about these things? Are we just giving up because it was frustrating, which is real and valid? Or are we saying, like, let's throw our weight around some so that we get what we need for the money that we pay?
Right. And it's unfortunate that people of color have to jump through all these hurdles when we're dealing with a lot of trauma. And then, to think about how onerous the process is to find a provider who can understand the trauma that you're experiencing by virtue of being Black or a person of color in this country. It's really frustrating that we have all these layered barriers in addition to what we are disproportionately having to deal with and face on a daily basis.
Absolutely. Absolutely. So true. And I think that, for me, it took me probably, I want to say 6 months to find a therapist who was a Black woman who I felt like could meet me at the place I was at and speak to me about all the things surrounding my lived experience, but with that overlay always of being a Black woman. That's how I walk through this world. And I think that, I gave up many times because I got so frustrated with the process, as you and I talked about. But I then had to think about, like, okay, where I have the energy and the agency to do so, how can I push on this to make sure that the world that my future children perhaps inherit, or that my neighbors inherit their children, is a space that understands that there is space that needs to be made for people of color, and that our interests shouldn't just be special interests. We are here in this country, in this community.
Exactly.
How do we make sure that people don't ignore us?
Exactly. I love that. Snapping over here.
I love it. So we talked actually a little bit about insurance companies. I'm going to skip that question for now, but feel free at any point, as you know, to add anything that was missed in the conversation that you want folks to know. Why do you specifically feel like it's important for young people, in particular, we talked about last time we spoke, Gen Z, to be advocating early on for their mental health? Why is that important?
Well, I think, this generation is constantly bombarded with a whole host of things, just by virtue of having so much access to technology, and how much, especially in the climate of COVID, that we're just inundated with information and other people's lives, and just things that we're trying to measure ourselves up to. And so I think this generation uniquely is dealing with a lot of different issues that, pre-technology, like being all over the place, that we haven't had to deal with. So I think that there's a level of intentionality that Gen Zers really have to have about protecting their mental health. I will say that they are fortunate in the sense that the stigma, thankfully, is not as much as it used to be in previous generations. I think millennials, we caught the very tail end of some of the real serious stigma that existed around mental health. But I think that as more celebrities, more influencers are being transparent and open and honest, and we're having things like today's event and having focused conversations about the importance of mental health, that they are well positioned to seek care. And actually the data is showing that Gen Zers are actually being more intentional about seeking mental health services, but they are also dealing with more anxiety and more depression. And I think technology also plays a role in that. I would say that it's important for them to start to take autonomy and ownership of their health from now. Like that transition from young adulthood or teenage, to young adulthood, it's a steep learning curve, and having to learn about like how health insurance works and co-pays. Like those are things that I think young people should be figuring out or learning about now, so that you're making better healthcare decisions for yourself when you transition into adulthood. So I think all of that stuff is important for them to keep in mind.
Absolutely. 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 Community, we have time, of course, set aside for you all to ask questions. So I'm going to give you a heads up that that's coming. So you can take some time and think for a minute or two about what questions you'd like to ask Ashley. We're going to ask one more question of you, Ashley, while those questions are populating. And then I'm going to have some of my friends backstage feed us some questions so that you can answer some of these questions for folks that are tuning in. What is, and this actually relates to originally what we were talking about, but I didn't ask this specific question. Relative to mental health, how have you seen folks use and leverage Health in Her Hue to have conversations about mental health? What are people asking about? What are the people wanting to engage around? Let us into that a little bit.
Yes, so we actually had a master class or an event with an influencer who's also a mental health profprofessional and a licensed clinical therapist. And many of the questions that came in was like, how do I find a doctor of color in network? So people, there's this question around access that keeps coming up that, just reinforces the need for platforms and solutions like Health in Her Hue. The other thing is like how to vet a provider. That's something that people want to know beyond just finding someone who looks like you. How do I know that the provider is actually going to address the specific needs I have? Whatever your trauma may be, you want to make sure that you're choosing a provider who's trained to treat you in that way. And so I find that many patients or users of our platform are looking for information to be more informed with how they're interviewing their providers. Or some of them are asking, what if me and a provider don't click? Is it okay for me to ghost them? And the therapist is very, very clear about you're paying for this service. So you need to make sure that you feel as comfortable and like you can be as vulnerable as you need for you to receive the quality of care and treatment that you are paying for. And so those are some of the questions that I'm seeing, and they're very interesting to me as I'm learning, like, what are some of the pain points that people are experiencing as they're trying to navigate finding mental health services.
Yeah, I love that. Community, I want to be clear. I was laughing just at the terminology, the ghosting terminology, but also recognize like that's an important question, right? And it's related to self-advocacy as well. If we are operating under the belief that we have to make sure that that we don't, how do I want to say this? If we're operating under the belief that we owe something to someone who is not necessarily clicking with us or not meeting our needs, we have to also practice the mindset of like, no, I'm doing this so that I can get the support that I need uniquely. And how do we practice that as a community and as individuals so that we can make sure that we get the mental health support that we need and deserve?
Right. That's so important. I would add one more thing, Rachel, is that I think, especially now because of COVID, that more patients are open to telehealth or teletherapy. And I knew that it was going to, I think pre-COVID, there was probably a lot of like, I don't know how I feel about it. But as I'm seeing in the Health in Her Hue community and some of the engagement we get from users is that, it's convenience. I don't have to like worry about leaving from work. Like it's literally just me and my laptop. I'm on Zoom or I'm on my phone and I can talk to my provider. And so it's interesting seeing how people are ramping up on leveraging digital solutions to get the type of mental health services that they need.
Absolutely. I'm really glad that you added that piece because I imagine that for some folks, that could still remain a barrier. So you could have dealt with all the other things. You could have identified a provider, have access, know how your insurance is going to work with you, and feel iffy about the telehealth piece. And I will raise my hand and I will say I was one of those people. And now having worked with my my therapist for I guess 6 months now that we've been, under shelter in place of sorts. Number one, I'm never late, which is something that I always struggle with. I was always late to my appointments, number one. And that did not contribute to mental health in any capacity because I was always running and always rushing. But also, I think, after this amount of time, it actually feels quite normal for me to have that connection with somebody over the computer versus in person. And I also imagine for some folks, that may actually be an easier access point than maybe sitting in person with someone that you don't know.
Right. I think it works for some and it won't work for others. I know when I had my first teletherapy session, I was kind of hesitant too. I like the experience of sitting on a couch and talking to someone. But I also was someone who would run late or have to like cancel my appointment because I'm working late or something like that, which defeats the purpose of not, trying to prioritize self-care. But I remember my therapist telling me when I first started the teletherapy that, there are certain things that I can pick up in person that will be difficult for me to pick up in a virtual setting. And I appreciated her calling that out because it is a different experience and it may not be great for everyone, but it's still, I've found value in still having those touch points with a therapist, especially in this time of COVID. So if anyone has trepidations around using this telehealth for therapy, I would say just give it a try. It may not be a long-term solution, but you can still get quality care through that virtual forum.
Absolutely. I'm really glad that you added that piece. Before we start to take questions, I also just want to add, hopefully this conversation and the conversation upcoming will illuminate for our community, the community gathered here today, that there are options within the space, right? So for someone who feels like telehealth works better for them, they can take that option. If that doesn't work for them, they can try that and then establish if it doesn't work. But I think oftentimes we feel like there's one way to get mental health support, and that's talk therapy and only talk therapy. And there's many different ways to get that support. And so I perceive the advocacy portion, the self-advocacy portion being like, doing the research to figure out what is actually available and then reflecting on what works for you best or what could work.
Exactly.
So wonderful. You're so wonderful. You are everything. You already know that. I tell you that constantly. Let's take some questions. Backstage team, can you feed me some questions for Ashley to engage with the community around? Thank you, Mani.
Absolutely. Thank you so much, Ashley, for being here. We have some really great questions for you. I can tell everyone is so engaged and you just shared a lot of good information. I was over here taking notes myself.
Thank you, Mani.
Yeah, no problem. One of the really great questions that I see here is if you have a PCP, primary care physician, new or longstanding, who is not a person of color, are there questions to ask to ensure that they understand culturally competent care? A few people have asked this question, so it seems like it's a popular one.
Yes. So I would say some of the doctors who work with me with health interviews say that you should be straight up and ask. If you go to our Twitter page, one of the it was two gynecologists. They said, like, ask your doctor straight up, like, how do you feel about Black people or people of color? Like, have you gone through any implicit bias training? Was that a part of your medical school training? Like, just really being as direct and candid as you want at the end of the day. If they feel uncomfortable with those questions, that is already a flag. They should not feel uncomfortable because it's literally like your health. It's literally a matter of life or death. If you don't feel comfortable with your doctor, if you don't feel like your doctor is providing the kind of care that you need. So I would say ask those questions, ask about their training, ask if implicit bias or cultural competency was a part of their medical training, or if they've done any CME courses to try to make sure that they're staying ramped up on that stuff. Ask all of those questions. Don't feel like you're crossing a line or that it's disrespectful. It's literally your health, and you should feel comfortable that your primary care doctor is a partner in your health and not someone who you feel like you have to side eye as they're giving you clinical care.
Awesome. Thank you for that. That's really good advice. Rachel, do we have time for one more, or would you like to cover one more question?
Yeah, I think that we have time for probably at least two more. We're making good time.
Okay. Awesome. Do you have any advice, Ashley, for mothers, mentors, aunties, any individuals who would like to start conversations with their children about mental health?
Oh, that's a really great question. I would say, yeah, I think I think getting children to just be familiar or comfortable talking about their feelings is like a great starting point. I think, a lot of the issues that adults have as they get older is like the concern about being vulnerable. So I think to the extent that parents can, when a child is crying or expressing some emotion, is like asking them to like really working with them to really sit and examine the root of what that emotion is that they're feeling and getting them comfortable with talking about their emotions. I'm not a parent myself, so I don't know the nuances of parenting, but I would say I think that that's a great starting point. It's like in real time, in those moments where children are expressing emotions, just really helping them learn how to examine them. And I think that that's creating or beginning that healthy engagement with feelings and emotions and vulnerability.
And then how would you say, we don't want to leave men out of the conversation, right? So
Right.
how can men of color begin to look for culturally competent care, or any specific advice around men of color and mental health even?
Yeah, so I will do a plug because like I said, I love digital health and healthcare innovations. There is an amazing company called, it used to be called Henry Health. It's since rebranded to Hurdle, and they are focused on providing men of color, specifically Black men, but men of color generally, mental health services and connecting them to culturally competent healthcare providers. So I'm a big proponent of like Black men, men of color, like get in therapy, please go speak to someone. And I know that there's still some stigma around the way that men are socialized and the way that we think about masculinity, but I'm grateful for platforms like Hurdle, aka Henry Health, and there's another company called Ayana Therapy that's also focused on, again, connecting people of color to therapists of color. So I would encourage Black men or men of color to find providers or find platforms that are intentionally trying to meet their needs, because all of us, based on our lived experience, have very nuanced experiences and need care accordingly. So I would encourage men to find platforms or solutions that are really speaking to their experiences as men of color.
I love it. Thank you, Ashley. We have time. We're making excellent time. We could do two more.
Awesome.
Let's see. Some of these questions are a little similar to the other ones. This one asks for you to elaborate on signs to look for, like warning signs to look for in terms of mental health for your children or yourself. Do you have any tips on that?
So mental health or therapy is not my realm of expertise. I believe in staying in my lane, but I would say just to I think on a baseline to just I think we all know our children, or people know their children, and so if you sense any change in behavior, communication, I think that that's a flag to look out for. Any sudden change in emotions or like typical habits, if you're not participating in some of the activities that they typically engage with, I think that that's an indication that you should check in. And moms have a very great intuition. I know my mother sure does. And so I would encourage moms or parents to lean into that. When you sense that something is off with your child, don't feel like you're crossing a line. I think that you should lean into whatever that is that's signaling that something's off, and find an appropriate time and place to try to have a conversation with them.
So I have my own question, maybe. So maybe I can
Okay.
take the surgery since I'm here. I'm very inspired. As soon as I heard about Health in Her Hue, I was like, oh, this sounds fantastic. I also know the anxiety that comes around following your dream, like trusting your own vision. I was so grateful to meet an individual like Rachel and some of my other peers who have been very supportive with my own ideas around MOCHA. And I'm like, this sounds crazy. And they're like, no, go for it. So can you share a little bit about what that felt like for you once you had your idea about Health in Her Hue, and what that looked like for you to just get started, or what that journey is looking like right now?
Oh yes, this is such a deep question to unpack, and Rachel knows some of the trepidation and fears and anxiety that I had and talked through with her. But what I always draw to this article that Dr. Melissa Harris Perry wrote, and she talks against like instead of self-care, squad care. and the importance of community being like our healing and our safe space. And so I have to say that I am fortunate and blessed to have strong community, an amazing squad of people that I know is essentially my safety net. And although everybody can't pay my bills, or like, so there's some like those real fears and anxieties of like adulthood. There's a comfort that I had knowing that I have people who have my back, who are cheering me on, who know the passion that I have and know the vision that I have and are standing behind me. So that is what keeps me going, just baseline. The other thing, I think, from taking it from vision and idea to actually executing on it, I was so burdened by this problem that I knew that I couldn't just sit with it. Like, that's when I feel like, you have to do something. Like when you're literally in bed reading a paper and crying and getting emotional about like the whatever the ill is in the world, I feel like that's when you know that you are called to do something. You may not be able to solve it completely by yourself, but you can do something that is pushing things forward. And so that's how I felt when I saw the outcomes for Black women. I was just like, I can't just do nothing. And just knowing that that burden is like just weighing on me, that is what keeps me going, even though I don't have all the answers of how Health and Earth is going to get built or how it's going to get funded. Just knowing that I feel like this is the purpose for which I am here and on this earth, that is what wakes me up every day and just keeps me working on at least one thing to push it forward. So that's literally what I've been moving on. It's like the energy and just knowing that I feel like I'm finally and actually doing the work that I'm purposed to do. That is what energizes me and keeps me going, despite the anxiety, despite the fear. That's what's going, or has me going.
Well, I certainly support you, and everything you just said resonates.
Thank you so much, Imani. And I'm inspired by MOCHA, by Maria. I really am.
Thank you. I'm going to return backstage then, Rachel, and let you take over.
Thank you. Thank you for stepping in. I mean, community, I didn't lie. I told you she's amazing. I told you that she's everything. I told you that what she's creating is super visionary. Ashley, I could not be more thankful to you for joining us today, for your vulnerability, for your just endorsement, again, of like taking care of self and taking care of community. I love hashtag squad care. We had that go again, across the banner when you said it. But thank you. Thank you for giving us so many just beautiful and important things to think about. Where can people continue the conversation with you and with the community that you've built if they'd like to?
Oh, yes, absolutely. So one, I just want to thank you for giving me the space to share today. I really love the work that you're doing. I'm a fan of you, Rachel, and love Peer Health Exchange as an organization. People can follow me. I'm on Twitter, literally my first and last name that's displayed there, Ashley Wisdom. And then you can follow Health and Her Hue on all social media platforms, Twitter, Instagram, and Facebook and LinkedIn at Health and Her Hue. And you can find our website, healthandherhue.com, to interact with the app and join our community.
So beautiful. Awesome. We appreciate you immensely. Thank you for being here. Folks, make sure that you do follow Ashley on all those platforms. I promise you will not be disappointed. Again, what she's created is something that I think we all need in our lives. Thank you, Ashley. Enjoy your day.
Thanks so much, Rachel. Thank you.
Community, we're going to take a 5-minute break. We're right on time. We're making excellent time. We're going to take a 5-minute break. We'll be back at 12:50 sharp. We're going to review our schedule to make sure that you understand how the rest of the day is going to flow. And then we're going to move into our second part of this two-part event and talk with a panel of folks who we have deemed experts around mental health. Thank you for tuning in. We will see you very shortly. Please stay with us. Please come back for part 2. Thank you. All right. I hope you all enjoyed your break. Now, I know that there may be some folks who were here for the first part of the session and not staying for the second part. We also may have some folks who are joining specifically for the second section. So I would like to make sure that I introduce myself to you in case you're new for this part. My name is Rachel Wiley. I'm the Bay Area Executive Director for Pure Health Exchange, and I'm very pleased to be moderating the panel that's upcoming for you all. Thank you for being here. Thank you for making time on a Saturday to give to us and to give to this community of folks engaging with and learning about mental health resources and how to access them. Very quickly, I just want to make sure I go through what the rest of our time looks like. We will end promptly at 2 p.m. Pacific and 5 p.m. Eastern time. We're going to jump in just a second into introducing the panelists that are going to be speaking with you today. We then will move to actually talking with the panelists, asking some questions of them, pre-prepared questions, and then we're going to open up the chat. And you should feel free to ask any questions that you have of our panelists. And Imani, who's the founder of MOCHA by Marie, is going to come back, and she's going to walk us through some of the questions that the community is asking. Again, we appreciate you for being here. First thing that I'd like to do is introduce you to who is on our panel. And so first thing, we have 5 folks on the panel. 5 folks who have been asked to be here for very specific reasons by virtue of their expertise around their fields and the work that they do every day, but also their expertise around lived experience relative to being a person of color. And what we love so much about these 5 folks is that they're bringing both their professional experience to engage with us, but also their lived experience, both of which we find incredibly valuable. The first person that we have on the panel that I'd like to introduce you to is Dr. Angela Diaz. Dr. Diaz is a professor of pediatrics and preventive medicine at the Icahn School of Medicine at Mount Sinai and director of the Mount Sinai Adolescent Health Center. She holds a medical degree from Columbia. She completed her postdoctoral training at the Mount Sinai School of Medicine and received a master's in public health degree from Harvard University. Dr. Diaz has provided direct medical services to children and adolescents for more than 25 years. It's a long time. She has been a White House Fellow and has been named numerous times as one of the best doctors in New York by New York Magazine. So we are very, very blessed and very, very thankful to have her. Dr. Angela Diaz is one of our panelists. The second of 5 panelists that we have, Dr. Natalie Watson-Singleton. Dr. Natalie is a mental health expert and a renowned speaker, researcher, and clinician. She is a psychology professor at Spelman College in Atlanta and the Diversity and Inclusion Education Director with Emory University Department of Psychiatry. Dr. Natalie sustains an active research program investigating how stress and cultural factors influence African Americans' mental health attitudes and behaviors, as well as how to tailor mental health services to address African Americans' mental health needs specifically. Also, as a licensed clinical psychologist, Dr. Natalie is the founder and executive director of NWS Wellness and Consulting. Welcome, Dr. Natalie. Third of 5 panelists, we have Dr. Christine Coleman. Dr. Coleman is a licensed doctor of marriage and family therapy, pioneering efforts to bring an intersectional, inclusive focus to the forefront of psychology. Dr. Coleman has provided support in the areas of adolescent and women's mental health, attachment trauma, and support for people of color alongside broader social issues, including racial and gender equity. She is also the founder and executive director of Soul Sisters Incorporated, a nonprofit with a mission to enrich, empower, and evolve women of all backgrounds through holistic health services. Her work was recently featured in Vogue magazine, you should know as well. Welcome, Dr. Coleman. We have 2 more panelists before we get to questions, team. 4th panelist that we're really excited to have with us today, Dr. Jorica Golson. Dr. Golson is a licensed clinical psychologist in the Washington, D.C. area. So we have people representing not just from the Bay Area, but folks who are representing all different corners of the country. I should also say that Dr. Natalie is a Bay Area native. She would want me to say that. Dr. Golson is a licensed clinical psychologist in the Washington, D.C. area. She obtained her doctorate in clinical psychology from Howard University and completed a postdoctoral fellowship at Yale University School of Nursing. Currently, Dr. Golson provides individual and group therapy to adults living with mood and anxiety disorders, as well as combat and sexual trauma. Dr. Golson is passionate about mental health issues regarding women and addressing the mental health needs of African Americans. Welcome, Dr. Golson. Last, but certainly not least, This person, I think we can assign an honorary doctorate to. He is not technically a doctor, but someone who I know can do anything in this life that he chooses to. He's a high school student. Deshaun Stewart is with us today. Deshaun is born in the Bay and raised in the Valley and has always spent his life trying to be better, a better brother, son, and student. Deshaun attempts to be a helping hand wherever he is needed, from things like being the co-president of his school's community service club to helping out the lunch ladies when they are understaffed. That's my favorite part. Deshaun is now on track to graduate at the top of his class and hopes to work in the medical field where he can be a familiar face to many people in an environment that sometimes works against them. So I'm going to invite our panelists to join me on screen. Really, really excited for you all to have a chance to hear from them and also to ask them questions. Feel free to put questions in the chat as we're speaking with panelists. One thing I would like you to do to make sure that we can ask as many questions as possible is please be very specific about who your question is for, and we'll make sure that if your question is asked, we direct it to that particular person. Thank you so much. I would love to introduce our panel. Hi, Dr. Diaz, Dr. Natalie. It's good to see you all. Hi, Deshaun. Dr. Stewart, if you want to be Dr. Stewart today, you tell me what you want. It's up to you. We have Dr. Golson, thank you, and Dr. Coleman. So excited. That's okay. Take your time, Dr. Coleman. So first question goes to Deshaun, aka Dr. Stewart, if he wants to be that today. Deshaun, what do you understand to be the source of the stigma that young people can experience when they're seeking mental health support?
Hi, thank you. Can you guys hear me all right?
Yes.
Yes.
Okay. From my understanding, a huge part of stigma that young people can face when trying to access mental health resources is just a lack of awareness and education. The conversation about accessing mental health resources is not had early on enough or often enough. I don't believe I was seriously introduced and informed about mental health until about late middle or early high school. Growing up, we're always taught about the importance of being drug-free or not bullying others. While these are very important topics, I do feel as though the root of these issues often ties back to mental health. If we're taught how a person's state of mind is influencing their actions, I feel as though we'd be better equipped to help out in these situations. This lack of awareness and education can also happen at home, I believe. When you grow up hearing or believing certain things, it's sometimes very hard to shake those opinions and judgments. Like, for example, people will have like a family member or relative with some diagnosed or undiagnosed mental health issue, but their family will always describe this person as crazy, off, lazy, the list goes on. These harmful characterizations, especially when heard by a child, can leave a lasting impression, including those unnecessary and unfair judgments about accessing mental health resources. Eventually, I think young adults tend to shy away from seeking mental health resources because they may not want those negative connotations that have been placed on mental health to be associated with themselves.
I love that, Deshaun, and I appreciate you so much for making sure to say all of those things. I'm really holding on to what you said. Panelists, I'm going to ask if you're not speaking to make sure you put yourself on mute, please. To be really mindful of the language that we use when we're talking about mental health and the way in which, if we're not mindful, or maybe if we just don't know, right, the right language to use as adults or as peers to students, we may not realize the damage that we could be doing, not just in this moment, but to someone's long-term lived experience, right? A lot of the things that we understand a lot of the things that impact us and ultimately shape our identities are learned in childhood. If we learn, I hear you so much saying, if we learn as young people that mental health is something to not be taken seriously or something to be weaponized, then folks don't then walk in a way that suggests that they understand that that's something that they can and should access and should promote for other folks. Would you agree?
Completely.
Thank you so much. Next question that I have, team, is for Dr. Watson Singleton. Hello, thank you for being with us today. I like your shirt. It's a good color for you.
Thank you.
Also, as I said, I'll say it again, Bay Area narrative.
Yeah.
Bay Area native, don't forget, she's at home in this conversation today. The question that I have for you, Dr. Watson Singleton, Dr. Natalie, is what is mindfulness and how can it support the mental health of youth of color in particular?
Yeah, so mindfulness refers to a way of paying attention to the present moment. So when we bring our complete, full participation, focus, attention to what we're experiencing in the moment, whether that's our thoughts, our emotions, sensations, sounds, we are practicing mindfulness. And we see that mindfulness is that way of paying attention can be incorporated into any of our daily activities, right? So we can pay attention to what the water feels like when it hits our body during the shower. We can pay attention to the sensation of the wind blowing up against our skin as we're walking outside. And there's also formal mindfulness practices, such as breathing exercises, focusing on the sensations in your feet as you're walking. And really, I think the importance of mindfulness is every time we bring our focus and attention to the present, we're letting go of our tendency to hold on to the past or the future. And when we get stuck in the past, right, that's often called rumination. We know that that is a risk factor for experiencing depression. And when we get stuck on thinking about the future, right, like what's going to happen, what am I going to do if this happens, that's actually a form of worry. And we know that worry is a risk factor for anxiety. And so mindfulness really, and that present focused attention really is a way to cultivate a sense of peace, a sense of calm, and can be really helpful for I think all of us, but especially individuals who find themselves getting stuck in the past or in the future. How it's relevant specifically for youth of color, folks of color, is myself and other colleagues have actually found that for individuals who practice mindfulness, that it's actually a great buffer against mental health symptoms in the context of racism. We know that to be a person of color in the US is to deal with chronic racism. Like there is no escape from racism. And so while we're trying to cope and deal with racism, how do we fortify ourselves? How do we take care of our mental health? And we know that there is documented evidence that suggests that mindfulness is one of those answers.
I love it. I love it. So many beautiful things to think about. And one of the things that I held on in specific that you said, hi, Dr. Coleman. One of the things I held on in specific that you offered is, my understanding that mindfulness, like you said, can be regimented. It can have a structure, but also the way in which, as we're talking about access, you can access that when you're in the shower. You can access that when you're taking your morning walk, as I do. And just utilize your mind to put you in a place where you're doing less of that rumination, as you said, and more of that just being present in the current moment. Love it. Thank you so much. Hi, Dr. Coleman. It's good to see you. Thank you for joining us. This next question, hello, is for both Dr. Golston and Dr. Coleman. So you're right on time, Dr. Golston. I'm going to have you go first. Talk to me about how trauma impacts our mental health. And hello, it's good to see you. Excuse me for rushing. I'm tied to the agenda, but also like it's important to say hello to folks. Hello, it's good to see you.
Good to see you too. Can everyone hear me? I feel like I always have technical issues with these things. Okay, great. So trauma affects us in a lot of ways, pretty much every facet of your life. And because trauma is, so the definition of trauma is essentially like a very stressful event in where you feel threatened, either physically or your life or your well-being, or you hear about the instance of someone that is close to you feeling that sense of threat as well. So kind of like what they call vicarious trauma. And trauma impacts us in terms of how we see ourselves, the relationships with other people, how we see our future even. And a lot of times with trauma, what happens is there's a loss of things we enjoy. So if you used to play the piano, that tends to fall to the wayside. If you used to have trust in people, that falls to the wayside. If you used to feel like the world was safe, that becomes very just changed up. And trauma impacts sleep. So oftentimes people with trauma have nightmares. They have a hard time falling asleep or staying asleep. And then because of the nightmares, they can be worried to go to sleep. So even like the bedtime routine gets changed because of trauma. Trauma impacts and the way we have an avoidance. So things that were things that are benign, things that are not actually inherently harmful, get associated with the trauma itself. And so when you see those things outside the context of the traumatic event, it triggers you. So for instance, if you were like, in a car accident and you've driven down the same road 1,000 times, but that one day you had a car accident, that road itself would be like, I'm not going there because it's triggering. Or if there's a particular store on that road, like say a McDonald's on that road, when you had the car accident, that becomes associated with the trauma. So anytime you see a McDonald's, that might trigger the similar response that you had when you had the traumatic event, such as like fear, worry, scared, heart rate increasing, tightness of muscles, all those things. So trauma is just, it becomes like a watershed moment for a lot of people where it's just everything is just upended. And it feels like, there is even a loss of who you are, your own identity can be lost from traumatic experiences. So you can start to wonder, who am I? I don't even know who I am anymore.
Thank you, Dr. Golston. And what I'm thinking about is just, we all have different lived experiences, of course. And so some of us may be dealing with a few triggers. Some of us may be dealing with a multitude of triggers. And so also I imagine that experience that one has, you could be triggered by so many things depending on your experience every time you walk outside. And that undoubtedly has an impact on your mental health.
Yeah. And the triggers are often, you don't know it's a trigger until you encounter it. And that's what's scary about it too.
Absolutely. Absolutely. Thank you so much for that insight. We'll come back to Dr. Coleman. It's all good. When she's able to join us, we'll make sure that we ask her for some of her expertise. Deshawn, I'm going back to you, and then I'm going to go back to you, Dr. Natalie, and then Dr. Diaz to you. We want to make sure you're in here too. Deshawn, my question for you is, what efforts can schools and organizations make to better support young people in regard to their mental health? What are your thoughts about that?
So first, I want to say that school is a major aspect in almost any person's young life. I don't think some people realize just how much time we spend in school. Like most of our relationships, bonds outside of family are formed there. And because we do spend so much time at school, it's inevitable that we will struggle mentally or externally at some point. And I feel oftentimes students, including myself, don't feel comfortable or feel the need to bring these problems home because they have other things going on. And because of this, schools and other organizations that do deal with young people on a daily basis need to be safe spaces for accessing mental health resources. So I feel like the first thing that schools can do is just start the conversation. And this just is bringing awareness to the issue, such as having just small events and giving staff instruction on dealing with mental health and letting students know that they now have a safe place to go if they should need it. And then elaborating on teacher instruction, teachers should probably be able to notice the signs of mental distress and how it's affecting the student's behavior. And if need be, they should be able to supplement discipline with attempting to get into the root of the issue. And I feel like that could really help improve student behaviors. Like I see countless times, it'll be like the same kids getting detentions, and then leading to expulsion. But I feel like if earlier on they like catch what's causing it, they can cut down on those behaviors and just make the whole environment better. And then schools and organizations should also make sure to, if they're able to, have professional or expert insight when dealing with mental health. Last school year, we unfortunately lost a classmate and I lost a friend. My school stepped up by bringing in a group of grief counselors on top of our normal counseling team. They let students take a break from class as long as they needed to in order to attend group sessions with the grief counselors. I feel as though this initiative could be a good example for other organizations, as my school had created a safe space to deal with that loss, and they gave us the aid from professionals from that specific field. And then whatever schools do decide to do regarding mental health, I feel like the most important key idea is consistency. I wanted to talk about a favorite author of mine, Jeffrey Canada. He's the founder of the Harlem Children's Zone. And in his book, Fist, Stick, Knife, Gun, which details the evolution of violence in urban youth, he talks about Band-Aid solutions. And Band-Aid solutions are just quick fixes that look good at the time, but they're just superficial. And they ultimately fail due to a lack of proper planning, foresight, or just decrease in attention and care over time. Schools and organizations must ensure that their mental health resources and practices stay active and aware.
Dr. Stewart, all the wisdom right now. Thank you. On a serious note, I want to make sure I give you all my love and condolences for the friend that you lost. We need to say that. And also continue to appreciate your bravery in speaking about this as a young person walking through this world in this moment. Last question I have for you related to what it is that you just offered is, talk to me about how you think schools may need to be even more diligent about these practices that you mentioned, given this current moment around racial injustice, around pandemic, and the effects that we know that those things are having on mental health, likely for youth in particular. Do you think that there's a particular focus that needs to be had on that right now?
I feel like the connection needs to be there. They need to not let students fall off just because they're not seeing them daily, because people do struggle at home, and then they feel like because they're not seeing their teacher, it's not their place to like email them, and just making students feel comfortable. And regarding like racial injustice, I feel like especially during this time, like virtually, it just needs to still be discussed and emphasized. Yeah.
Thank you, thank you, thank you so much, Tashawn. I'm going to go to Dr. Watson Singleton. Thank you. Dr. Natalie, the question I have for you is, what role does stigma play as a barrier to individuals of color accessing mental health resources?
I think Deshaun offered a lot in terms of how stigma plays a role in being a barrier. But I think it's important to understand that although stigma is a general term, that there's actually different types of stigma. So there's a type of stigma that's referred to as public stigma, right? So these are the beliefs that society holds towards people with mental illness. And I think Deshaun named some of those views or beliefs, right? The idea that people with mental illness are crazy, are incompetent, are incapable, are dangerous, are emotional, right? These are negative and inaccurate beliefs that the society has about people with mental illness. And then there is such a thing as self-stigma. These are the beliefs that people with mental health diagnoses turn on themselves, the way in which they internalize society's negative and inaccurate views of them. And there is data that supports that stigma does contribute to the underutilization of mental health services, because people, if you're aware of these negative attitudes that society, family members, church members have of you, you don't want to do anything that can then reify those negative beliefs. And so it really does put people in a box from being able to access services that could be so helpful in them building the life that they want and they desire. And this is especially true for communities of color, right? Like if I'm already stereotyped as a Black person, as a Black woman, the last thing I want to then deal with is have to be stereotyped as a Black woman with a mental health diagnosis. And so I think that there are ways in which all of those compounding pieces accumulate to then negatively impact folks of color's ability to then feel like they can adequately access those services.
Absolutely. What's funny, nothing that you said is funny. It's all really critical information. What's funny is I realized I have all the amens for you as you're speaking, and I was on mute, so nobody heard any of those things, and that's okay. I'm sure they saw. I just want to double click and pin up what you said about building the life that you want and how critical that is. I mean, Ashley talked about, and folks who are who have joined us for the full time heard Ashley Wisdom speak about her journey as somebody who is building a business around, making sure that culturally competent care is available to folks. And also spoke about the way in which she has to be extra mindful in some capacity about her mental health so that she can keep moving that dream forward. So I love that you said that. Yeah. Mm-hmm. Thank you so much. We're going to go to Dr. Diaz. This is your first time seeing her. Thank you, Dr. Diaz, for being here.
Thank you.
My question for you is, what do you understand? So we just talked about stigma with Dr. Natalie. Mm-hmm. What do you understand to be other key barriers to individuals of color accessing mental health resources? What else should we be thinking about in addition to stigma?
Thank you for the question. Other key barriers to access to mental health include that people of color may not have health insurance. Out of my patients, and I serve in my program over 12,000 youth per year, 70% do not have health insurance, and they are mostly Black and brown youth. Another barrier is that there is inadequate number of mental health services, that their existing services are hard to find. Lack of culturally sensitive and culturally relevant mental health services. Lack of bicultural and multicultural services. Lack of diversity in the mental health workforce. Lack of mental health services that are provided in languages other than English. The hours of operations are institutions and staff-centered rather than patient-centered. And what I mean by that is the services tend to be provided at the traditional 9 to 5 hours when patients have to work. The mental health professionals in private practice tend to provide hours that are much more practical and more flexibility. Another barrier is that it is hard to pay for mental health services out of pocket because they tend to happen frequently and can last for weeks, months, or years. In terms of young people, I often say that the healthcare system in the US was created by adults for adults. And when we try to fit young people into that system and it doesn't work, we blame them. We call them non-compliant and hard to reach, when indeed what is hard to reach are the services, the way they are designed. Young people need youth-friendly services that are developmentally appropriate, provided by professionals who love young people and have the passion and skill set to serve them.
Yes to all of that. Dr. Diaz, I know that you are one of those practitioners who loves young people and that you've devoted your life's work to this. And so I'm so glad that we're having this conversation with you. The piece that you just said about, who designs a system and for whom is such an important concept. And we talked about that also in the earlier session. How do we push back as folks of color on systems so that they're actually delivering the results that we need and providing the access that we need versus doing what is best for them. The language you used was being staff-centered versus patient-centered, and that's sitting with me. So thank you for offering that piece, that language.
Mm-hmm.
Thank you so much. We'll come back to you in just a second, Dr. Diaz. The next question is for Dr. Golston. Dr. Golston, my question for you, and actually this question was asked in the earlier session, so I hope the person that asked it is still here, because I was like, okay, this is an excellent question for Dr. Golston. What would you recommend as a first step for folks who are seeking mental health support? First part of the question. Second part of the question is, what do you understand to be the role of self-advocacy in those initial steps?
I think self-advocacy is extremely important. What I always tell patients is, it is your healthcare. Yes, it's mental health, but it's your healthcare. So the same steps that you would take, similar steps that you would take to find like a primary care doctor or a doctor for any other reason is what you should fall back on when you're looking for a therapist. And what I encourage people to do is first identifying if you really want a therapist and if you're ready to work, and then what you're ready to work on. So what kind of goals do you want to have in therapy? Like, do you want to be less depressed? Do you want to make more friends? Do you want to have less stressful relationships with people? Those things. And the first route I tell people is to talk to those who are seeing a therapist. Like if you know of people who have a therapist, ask them for recommendations. People that you find that are safe, trustworthy, dependable. Those are the people that if you know they're seeing someone or they know therapists, start there, because word of mouth is really important. And you can also get an idea from that person about what that therapist is like to see if it would be a good fit. And fit is very, very important. And I think that when you have a therapist, or when you're looking for a therapist, the first phone call is not just them trying to see if they can take you on, but you're interviewing them. So having a set of questions about what kind of degree do they have? Like getting a license number. I always tell people, look them up to make sure they're legitimate, have a license, because there's a big difference between a life coach and a therapist. And psychologists are the ones you see that have a doctorate, so a PhD or a PsyD behind their name. If you see LCSW, it's a licensed clinical social worker who has a master's degree. LPC is licensed professional counselor, I believe. So if that's important to you, look at that. You can ask them too, do these people, ask the therapist, do you have experience in treating people with whatever the problem that you're coming in with? So if you're someone who, has issues in school, make sure to ask them, do you have experience with this? And the question I always tell people to ask is, what is your style of therapy? Asking the therapist, what exactly is your style of therapy? You can get an idea of, and I encourage people to shop for a therapist. So maybe make an appointment 1 week with therapist A, week 2, another appointment with therapist B, week 3 at therapist C, and see how that goes. And I know it gets really tricky with insurance because they only give you like a certain number of sessions or things like that. So you might want to have to check in with your insurance. But I definitely am strongly push for having, in the beginning, having more than one therapist just to get an idea. And the one you feel like you mesh with the best, that's the one you stick with. And going into therapy and being really clear about what you want to discuss and letting your therapist know, like, I want to work on grief. Yes, I may have all these other issues, but right now grief, the person I just lost, is impacting me the most.
Yes.
And because therapy is for you. And so you should be guiding that shift to a degree. It should be a collaborative effort. And because it's a collaborative effort, you have a say. Yes. You have to say about what you need, what you're trying to get out of therapy.
Excuse me, go ahead.
And the places I suggest to look for a therapist, if you don't know anyone who's in therapy or who hasn't told you they're in therapy, because a lot of people don't talk about it. I suggest going to Psychology Today, which is a website where you can type in your zip code or where you live, and they'll come up with a whole lot of therapists that you can filter out. When I say filter out, they have a column on the left side where it has, what issues they're specialized in, what insurances they take, all these other issues, all these other things. So you can filter it out there. There's also Therapy for Black Girls, which is a directory that has a list of therapists who specifically deal with women of color or Black women. And then there's also InnoPsych, INNO Psych, which is another directory that also lists therapists of color as well who treat people of color. So both of those sites, they're InnoPsych and Therapy for Black Girls, it ranges from children all the way up to geriatric patients, so elderly patients. So, but it's specifically tailored for people of color seeking therapy.
So perfect. So many gems in that conversation. I love that you shouted out Therapy for Black Girls. That's where I found my therapist after having some really unsuccessful journeys and trying to find a therapist who's a Black woman who, all the things that you spoke to, knew how to navigate the experiences I was having and who wanted to work with me as somebody leading the conversation, not just a participant who showed up. I want to just double click on what you said about, I think this is important for folks to hear again, being ready to work and also goal setting relative to your therapy experience, right? I think I've never heard anyone say, in probably the 3 different periods of my life I've been in therapy, like, you need to do some pre-work before you come to therapy. There's some things that you need to understand so that you can advocate for what you need. And so I'm really thankful that you cemented that piece in particular. That resonated with me really deeply. In order for us to drive, in order for us to self-advocate, we have to be clear about what it is we're trying to achieve.
Yeah. And sometimes you're not clear. Sometimes you're like, I know I don't feel like I usually feel. Something's wrong. I don't know exactly what's wrong, but something's not right with me. That's a starting place, because therapy can help you identify what exactly is important to you, what are your values, and that can help you figure out what kind of goals you have in therapy. Therapy can also help you with, being more ready for therapy. Like you're half foot in, half foot out. And that's something you can say too when you're doing this. And it's a screening call. When you first call them and you're getting information about them, that's when you ask those questions I mentioned before. And you can ask them, like, do you do any work with helping people stay motivated while they're in therapy? Because a lot of times you're going to leave therapy and you're not going to feel good. I think people have this idea that therapy, like, oh, this is, I feel great, it's so much better. No, sometimes you're going to leave therapy and you're going to feel awful. You're going to be crying. You're like, why did I even do this? What am I paying this person money for? So bad. And that's part of getting over the hump, particularly in the beginning, when we address things that we've pushed to the side for so long. So it's really intensely emotional when we start tackling it. So that's where you need someone who's very encouraging, very validating, to be supportive and non-judgmental for you in therapy. And that's what a therapist should be. So those things I think are really, really important.
Thank you, Dr. Golston. So many things to hold on to from that conversation. I appreciate you. If we have Dr. Coleman on the line, I will take her next because I have a question for her. If not, the next person up is Dr. Diaz. Okay, why don't we try Dr. Diaz? Excellent, thank you. Dr. Diaz, the question I have for you, I'd love to talk with you about integrated services because I know that that's the work that you do. I had never heard that concept before you and I spoke, and it's intriguing me. I've been doing so much research on it because I just find it so intriguing, and I'm excited for our community to hear about it. My question for you is, what makes that model particularly accessible for youth as it relates to mental health?
To me, holistic, comprehensive, and integrated services are really important to serve the population overall, but particularly for youth in general, and for all who work really hard and do not get paid livable wages. So, people from low resources. And let me give you an example. If a person needs to get a physical exam or other medical services, they go to one place. If they need family planning, they are sent to a different place. If they need a dentist, they go to another place. If they need mental health, they are yet referred to another place. These appointments tend to be on different days. That means that a person who works needs to miss all those days from work. And this is likely to get them in trouble with their employer and even contribute to losing their jobs. But even if the employer is okay with this will have tremendous impact on their income. And they are low-income people that need to work to be able to support themselves and their families. And often what happens is that they end up not getting the services that they need. The same is true for young people. If they work or they go to school, if they have all these different places to go, they tend to get behind in their work, miss school. Their performance in school really get affected, and they may end up actually leaving school after they have been absent for so many days. And this is obviously not great, but the worst yet is that they tend not to get those services that they so desperately need. To avoid stigma, the Mount Sinai Adolescent Health Center, the program that I run in New York City, we call it simply a youth center. We were talking about stigma before. It is not a mental health clinic or a substance abuse clinic or a family planning clinic or an HIV clinic. It is really a center that provides holistic and comprehensive integrated medical, sexual and reproductive health, dental, optical, health education, behavioral and mental health services. I often say from head to toes, from mental to dental. We also provide legal services, educational support, mind-body services, including yoga, and self-expression through the arts. What makes this model particularly accessible for youth is that it relates to mental health, is that if myself as a medical doctor, I'm seeing someone for a physical exam or for a medical issue, and I find out that the young person has a history of childhood sexual abuse or is depressed or has any other situation for which I think mental health can be helpful, I can just say to the young person that given what they share with me, I think they can benefit from talking to someone, and that my colleague so-and-so is available to meet with them at that time during that same visit, just to be helpful, to really help them. At that moment, I can connect the young person to the mental health provider in a seamless way, and the young person can receive the services that they need rather than me having to say, you need mental health, and I will be referring you to a mental health professional, and you need to make an appointment. And often when the young person calls for an appointment, there is likely to be a waiting list of weeks or months for services. But the worst yet is that they may really not even call because it's additional steps, because they don't know what to expect from the mental health professional. And they may be anxious to go through yet another place and meet another person to discuss something that they may find very painful and difficult to talk about. That is why I think these integrated services are so important for young people, because it makes it easy for them. Everything is under one roof, and you can really bring all those services to them during that visit or multiple visits, but in that place where they feel comfortable. Young people need to feel welcome, respected, connected, safe, and not judged. And a place like that, an environment like that, makes it easier for them to really get those services that they need. And they're much more likely to get those services if you provide them like that.
As I told you, Dr. Diaz, I mean, I get so excited about this model, as I told you many times. And what's sitting with me is what you just said: welcome. Young people need to feel welcome, respected, connected, and not judged. And that, to me, harkens so much to what Dr. Stewart, otherwise known as Sean, said earlier. You know, these are the things that young people need to feel supported. I'm also thinking about the way in which, you know, there's so many things that we do in partnership that are team efforts. And if we don't treat healthcare in the same way, there's all these missed opportunities and all this damage that, quite frankly, can be done for young people that we want to avoid.
Yep.
Absolutely. Thank you, Dr. Diaz. Next question is for Dr. Watson Singleton, otherwise known as Dr. Natalie. Dr. Natalie, question for you is, what do we know about folks of color and suicide prevention?
So, so much. So much and so little at the same time. So we do know that suicide is the 10th leading cause of death overall in the US, and the second cause of death for individuals ages 10 to 34. So a significantly huge risk for young folks. And I'm not sure if anyone saw this, but there was a national report that was released this year, 2020, that actually showed that among children ages 5 to 11, Black children had the highest rate of death by suicide. And this is, I think, concerning for a lot of reasons, but especially concerning given that African-American kids, youth, And youth of color have traditionally and historically had the lowest rates of suicide. So to see this kind of increase and these kinds of peaks is especially concerning, given historically what we knew to be true. Some reasons for this increase has to do with some research has found that the kids who and the youth who are most at risk are for youth who have decreased ethnic identity. So who feel less connected to their racial and ethnic group, have a lower sense of racial or ethnic pride associated with their racial and ethnic identity. We also know that increased stress associated with acculturating to mainstream white culture is a huge risk factor for suicide. I think in California, you all just passed a law that allows people to actually, folks of color, to show up in the workplace with their natural hair. Like, the idea that that's just now getting passed is ridiculous to me.
Just now. Mm-hmm.
And so if you think about just the strain of not being able to show up as your true authentic self and how that is increasing the risk of suicide for youth of color, we also know that increased experiences of racism is a huge risk factor for suicide. So in terms of what we can do about it, I think the first thing we need to do is replace the myths about suicide with accurate information. Mm-hmm. For the longest time, there has been the myth that folks of color are not impacted by suicide, or that suicide is a white folks problem. And that's absolutely not true. And in order for us to intervene, we have to recognize that it's something that impacts our communities as well. Mm-hmm. I think there's also the myth that talking about suicide causes suicide. And so you have people who are communicating, whether verbally or non-verbally, that they need support, and nobody's doing anything about it because they're afraid that if they say something, that's going to push the person to take their life. And that's absolutely not true. So I think, again, the first step is replacing inaccurate information with accurate information. The second thing is, I think we need to talk about it, especially when we think that someone in our life, someone in our circle, someone in our community may be at risk. Mm. Actually, a national certification program for people in the community. You do not have to be a mental health professional to take part in this training. And it's actually called QPR. I'm not sure if people have heard of it, but QPR, which stands for Question, Persuade, and Refer. And really, that's what you do, is asking people directly, if you suspect that they may be at risk for suicide, ask them, have you been having thoughts of taking your life? Have you been having thoughts of hurting yourself? Persuade them to seek help and to let them know that you're willing to work collaboratively with them to seek that help, right? That they are not alone, that you are going to be there in that process for them, and then refer them out, refer them to a mental health professional, refer them to a hospital context, refer them to professionals who are equipped to provide that necessary support. The third thing that I think is so essential for suicide prevention is recognizing the warning signs. So recognizing those things that may cue you in that someone is thinking about hurting themselves. I think some changes that we recognize in terms of how people talk is when people are talking about hurting themselves, when people are talking about feeling hopeless, feeling helpless, when people are talking about feeling like they are a burden to others or a burden to important people in their lives, when people are talking about having no reason to live, right? Those are often risk factors or shifts that may be going on to signal that someone is thinking about ending their life. Other sort of behavioral things, if someone is withdrawing and isolating, if they're using substances more, if they're giving away prized possessions, if they're researching methods to end their life. Again, I think the more we know, the more that we can then sort of step in for these signals of help that folks are looking for. And then I think lastly is planning for crises. And these are for folks who, if you have loved ones who you know have attempted suicide before, one of the way, or who have who've experienced suicidal ideation, it's so important to plan for crises. So what that means is, right, working with your loved one and says, what are your specific warning signs? What kinds of things should we be looking out for you? How do we know that you're feeling more suicidal? How do we know that those thoughts of ending your life or those shifts in behavior might be concerning? And then how would you want us to intervene? And I think families and loved ones and friends, when everybody can talk about those things and everybody can get on the same page about those things, and doing that planning when there's not a crisis, right? I think that's the important thing. Do that crisis planning when things are relatively, stable, so that you are ready to hit the ground running when the crisis approaches.
So many things to think about. Forgive me for all the movement in the back. My computer does not want me to be successful right now, but I got it under control. So many things to think about. I hope, community, that you took a lot from what was just said and that you made notes, and that, what I'm holding on so much of, Dr. Natalie, at the end was just, this can be a conversation, and not only can it be, it really should be. And I've never had anyone share that thinking before, that like we can proactively plan to do everything we can to avert crisis by practicing good communication with our family and our support structures.
Yeah. So many people are scared to talk about suicide, and I understand that it is a scary thing to think that you might lose your loved one. And being prepared starts to decrease that sense of fear and anxiety. Absolutely. Right? Think about it. Well, I don't know. People have plans for, like fire safety, right? Mm-hmm. Fire that breaks out in the house, what are you going to do, right? If there's a hurricane or a tornado, what are you going to do? Similarly, if you have a loved one who's at risk for suicide, planning for those crises as well.
Absolutely. So well said. Thank you so much for all of the knowledge that you just dropped on us. I'm going to take about, Dr. Coleman, I'm going to see if you're with us still. I'd love to ask you a question to end this panel discussion before we pass it to our folks. Good to see you. Give me 2 seconds to get my iPad, and then I'm going to actually, we're not going to do that. We're not going to waste time.
Oh, no worries. Thank you, everyone, for your patience. It was not my intention to be outside. With the
not a problem at all. It's a beautiful day. We're happy to have you. It's all good. Question that I have for you to end our panel today. Let's talk about mental health as it relates to activism. So we know that the world of activism, this is the work that you do, and that you're very passionate about. So you're the person to be talking about this for sure. What do you perceive as the mental health gains and challenges associated with activism, especially for young folks?
Yeah, and first and foremost, I just want to say, I've been just listening to everyone's feedback and expertise, and it's just such an honor to be in this space with you all. You're all doing really critical work in the realm of mental health, and it's just so necessary and so powerful. And for me, working with Soul Sisters has given me more insight into the world of activism, particularly in the world of feminism. And when I got my PhD last year, much of my focus was on the mental health effects of activists, specifically intersectional feminist activists. So fast forwarding to times right now where we are seeing a lot of racial unrest, gender unrest, and continued fight for equality and equity across various forms of oppression. And it is really important for me, and I think for others, especially as young folks continue to trickle their way on into this current form of activism that we're seeing, to continue to see like what's going on with our mental health. And I think about that often, especially when I see folks online engaging in social media and various forms of online activism. What's going on when someone leaves you a death threat, someone leaves you a sexual harassment threat on a comment section, or what is going on when you are taking it to the streets and you are looking for opportunities to serve and get your voice heard and get met with police brutality and various forms of violence, or other family members or people you thought were peers all of a sudden calling you out for something you thought was the right thing to do. So there's a lot of layers to this that has me interested and a lot of other folks interested in just continuing to examine what's going on within your heart and your mind and even your body as you experience these forms of mental health impacts. I guess we can call them impacts, both positive and negative. And so between my research as well as the research that I did to inform me better, on the negative side of things, if we could just start there is a lot of heightened levels of depression and even suicide, if not suicide attempts or follow-throughs as a result of activism. And I don't mean to set that in the tone of if you do this and that's going to happen, but we can understand likely that it's going to be a possible outcome if you're constantly bombarded with these negative messaging. And it is something that we fight for. It is so ingrained in our souls, right? It's like, I believe in this so hard. It either represents a part of me or people that I love or care about, and I want to put my best foot forward. But when I do that, I'm met with such violence, whether in words or in action. And so that can cause someone to really have a lot of mental impact and strain as a result of this work. Burnout is another one that has been mentioned, I think, even in this circle briefly, as well as just in research over time, that when you put forth so much effort and time and energy into anything, but especially in activism, and you're being met with these sorts of barriers and pushback, that the burnout in this work is very, very real. So what does burnout look like? It could just be, again, staying up day and night, having that emotional exhaustion, watching the news, looking at your media, taking it to the streets, engaging in constant conversation, only to be met with so much pushback and negativity. And again, sometimes going back to that violence, both verbal, emotional, and physical. So you can imagine that being burnt out because you exhaust so much of yourself into that is very common. But yet the thing is that people who experience a burnout are oftentimes not knowing when to check in with themselves and push that pause button. Much of that has to do with the fears that if I tap out, what's going to happen to the movement?
Yes.
Right. So part of that self-care includes knowing that if you take some time to pour into your own cup, take a rest, take a time out of social media or the media or even the organizations that you are a part of, whether in your school setting or your work setting or otherwise, your social settings, the justice settings that you're a part of, that the movement is still going to continue and you can still always dip back right in, right? So if you're a part of close social circles or circles that align with the same values that you're fighting for, if you're able to come up with that confidence to value your own mental wellness and say, you know what, I'm still so down for this cause, I still am going to continue this work, but I need to just take couple hours, a couple days, a month, a couple months, whatever that timeline feels and looks right for you, excuse the background noise, then I think that that's really, really crucial to do, because that is a form of self-care, as we've heard this word self-care thrown out so many times, right? So in activism, self-care is definitely a part of the component. I heard someone say, and I can't remember who said it, but I heard someone say recently, a really profound insight that I can leave with you all is self-care is part of the resistance. It's part of the resilience. It is actually an act of resistance and resilience to care for yourself and your mental health. It's part of that recipe, right, for moving forward and for progress. So as young people, as you continue to figure out, what does activism look like for me? What does it feel like for me? Who's in it with me? If you can factor in, yes, there could be some negative repercussions as a result of this very passionate, very necessary work. There also are ways to counterbalance that with your self-care practices. And the last thing I'll say is, when we talk about self-care, yes, of course, one method being timing out. Another method should be rounded with the umbrella of, what does self-care look like and feel like for me? Not what everybody else is saying self-care is. What is it like for me? And that's not just like getting a facial, getting your nails done, or getting a new outfit like everyone else in the media is kind of saying. It really is like, is it this book that has nothing to do with activism that I want to read, or this podcast that has nothing to do, or this show that is just pure joy for me? And again, activism is pure joy for a lot of people, so that is a good thing. But if you're noticing my mental health, I'm really tired physically and mentally, I'm really overwhelmed, I can't stop crying or thinking, I just feel really low at this point in my life. So anything that self-care has to do any part of self-care that has to do with just really taking a time out. Participants in my research would say things like they really leaned into their spirituality. So whatever your spirituality looks like for you, prayer or community with other people, meditation, in just various forms, and just get really clear on what that self-care looks like for you, because activism is, it's the personal is political. So it's a personal tie that you might have to this work. And so if you know how to navigate that and start early on as a young person to know, I want to be so much a part of this cause, but I also want to know how to take care and honor my mental wellness, it actually is contributing to the larger movement that I am contributing to. So I hope that's helpful to somebody, because this work that you're doing is so crucial, it's so pivotal, but so are you. And you need your energy and your light to continue to shine as much as in your own self, as much as what you're doing that's part of that is beyond you.
So beautiful. I won't add anything to that, because all that needed to be said was said. Thank you, Dr. Coleman, for ending our panel. Community, we have, certainly, thank you. Let's take, Imani, maybe, let's take about 3 to 4 minutes to do, let's see if we can get 2 questions in. Yeah, let's see if we can get 2 questions in. Let's see where we end up.
Sounds good. So much good information, so many great questions, a lot of great reactions. Let's see if I can grab one that was specific. I know we had a question for Dr. Golson. As an educator, Dr. Golson, I'll just add you to our stream. As an educator returning to the classroom after the pandemic, how can we respond or interact with students in a trauma-informed way?
Yeah, I think what I wish was that there was more trainings or something for educators to pick up on, symptoms of trauma or traits of trauma. I think one of the main ways to look at it is, like, if you notice someone who used to be really focused, used to, have a lot of energy, and all of a sudden they have a hard time concentrating, or their just overall mood levels just deplenish, like they're just not as interactive in class, they're not as eager. Those are some telltale signs there. It is kind of hard because everything's virtual these days too with students, and that's what makes it difficult. So even things like just not showing up to class, reaching out like, hey, what's going on? What's going on there? Asking those simple questions, noticing any kind of just like anxiety or more worries, like, children worry typically, particularly teenagers, if they're very overachieving, they worry more, but picking up on any kind of worries or things like that is what comes to mind for me with that question.
Thank you so much for answering that. Rachel, would you like to move forward with one more?
Let's do one more. I'll make my closing really short and succinct.
Okay. Another question that we have is, this one, it actually isn't directed to anyone in particular, so I'm not sure if someone wants to nominate themselves for this one, but how can you help a family member who has been struggling with their mental health but is not making progress with their therapist, or hasn't yet started doing the work? What I can do is actually add everyone for this piece, so that if you want to nominate yourself for this question, you can. You just have to unmute yourself, of course.
I can start, and then if someone else wants to jump in, they can. I think I would first want to know more about where the disconnect is, right? Is the disconnect lack of motivation or ambivalence on the part of the family member? Is it a question of fit? I think Dr. Golson was talking about therapist fit. So is it that the progress isn't being made because a new therapist is warranted? It is perfectly okay to fire your therapist if it's not a good fit, or to move on until you find the right fit. And then the other thing that I really think that it's important for family members to recognize is that you can only do as much as you can do. That it is totally important for you to respect the autonomy and choice of your family member. Just because your family member has a mental health diagnosis or has mental health challenges does not mean they are not an autonomous person who can make their own choices. So, and I think that that's really hard for family members to accept because, you know, we can get really invested in our goals for our family members. And I think part of the coping is how do we cope with the discomfort that comes with our family members not doing what we want them to do.
Imani, I think I see Dr. Diaz. Dr. Diaz, you have the last spot if you want to take 30 seconds.
I just wanted to say that it's also very important for parents to give privacy and allow their children who are youth to have confidentiality, because if they know that the conversation they have with their therapist or their provider is private, they are much more likely to really share of themselves, to say how they are, what they are thinking, what they are feeling, what they are doing. And that's what we want, right? And if we think that they are in danger because they are suicidal, they know somebody's going to get killed, obviously those things are not kept confidential. But I think that sense of privacy is really, really important. And some people are struggling now with teletherapy because they're home and everybody's together. And some of them are going to the bathroom to be able to have a little privacy. But it's really important for the adults to understand and even move away or understand that a young person has a right to privacy.
Such a critical point. Excuse me, Imani, please go ahead.
Oh, I was just agreeing. I mean, there were so many like really, really powerful points that you all made, but each one really just hits home. So I'm just like,
yes. Team, we are so grateful to you all. I mean, we couldn't have asked for this to be a better, I think, gathering of folks with the knowledge that you all have and with the sincerity that you bring and with the commitment that you clearly have to making sure that this conversation becomes less stigmatized and a more open conversation, especially as it relates to youth. So we don't have time to express all the gratitude that we have for you, but please know you are so deeply appreciated. Thank you for making the time to be here today. And to the community, thank you for making time to be with us and engage in this conversation. Thank you for your questions. Thank you for your attention. Thank you for your engagement. Thank you for your patience as the technical difficulties happen, as they always tend to in some capacity. What I'd like to leave you with is, again, our gratitude. We also are going to be sending a survey to all registrants just to ask you, how would you like to see this conversation continue, perhaps? How did you feel about the conversation had? What was great? What could have been better? That feedback is immensely helpful to us. And so please make sure you provide us that feedback. Stay in touch with us on social media. Visit our website, both for MOCHA by Marie and also Pure Health Exchange. We are present in various social media spaces. There's a banner that's running along the bottom that may have that information. But if not, it will be included for you in follow-up. Please stay in touch with us. We're really thankful that you joined us today. Lastly, I just leave you with a statement of well wishes. We love you, we appreciate you, and we see you. Continue to take care of yourself and of others. One more time, you have the National Suicide Crisis Hotline, that number going across the bottom banner. Please make note of that. Please use that as you need to make use of it. Thank you so much for joining us today. Enjoy your Saturday.